What are mitochondria and what are the signs of mitochondrial dysfunction? Mitochondria are the tiny organelles in our cells that perform several vital functions. Each cell can contain several hundred to many thousands of mitochondria depending on the cell type. They are best known as the powerhouses of the cell since they produce 90–95% of cellular energy as ATP. They also regulate apoptosis, programmed cell death and recycling, calcium channels, and stem cell activity. There are many things that damage our mitochondria and cause them to malfunction or die off. When they stop working properly, it can affect your energy levels, organs, and overall health, i.e., everything. This is known as mitochondrial dysfunction, and it is the root cause of all chronic disease. It typically develops slowly and silently, thereby creeping up on use before disease processes and degeneration show obvious signs. Recognizing the signs early can help you take action before serious health problems occur. Common signs of mitochondrial dysfunction. Mitochondrial dysfunction affects many parts of the body, so symptoms can vary widely. Below are some of the most commonly reported signs. 1. Chronic fatigue. Feeling tired all the time, even after a full night's sleep, can be a red flag. Since mitochondria produce energy, their dysfunction leads to low energy levels throughout the day. 2. Muscle weakness or pain. Frequent muscle cramps, spasms, or weakness, especially during or after exercise, can be linked to poor cellular energy supply. Muscles have one of the highest concentrations of mitochondria. That's why easy muscle fatigue is a major red flag and sign of mitochondrial dysfunction. 3. Brain fog and poor memory. Difficulty concentrating, forgetfulness, and lack of mental clarity are common signs. The brain uses large amounts of energy, making it highly sensitive to mitochondrial problems. The brain and nerves have the highest concentration of mitochondria of any tissue in the body. 4. Digestive issues. Slow digestion, bloating, constipation, or irritable bowel syndrome, IBS, may appear when mitochondria in the gut cells aren't working properly. When mitochondria are damaged, the cell produces significantly less energy than it needs. This leads to the inability of the cell to perform its vital functions and repair itself. 5. Sensitivity to cold or temperature fluctuations. Poor temperature regulation, feeling unusually cold or hot, may be caused by metabolic imbalance linked to faulty mitochondria. 6. Headaches and migraines. Recurring headaches, especially migraines, can be a warning sign, particularly in children and women. Energy imbalances in brain cells often play a role. 7. Mood disorders. Anxiety, depression, and mood swings are often linked to inflammation and impaired energy metabolism in the brain. 8. Exercise intolerance. If simple physical activity leaves you extremely drained or sore, this could signal mitochondrial inefficiency in your muscle cells. 9. Poor growth or development in children. In children, signs might include failure to grow, delayed development, or motor coordination issues, which may indicate inherited mitochondrial disorders. 10. Increased risk of chronic diseases. Long-term mitochondrial dysfunction is associated with a higher risk of type 2 diabetes, Alzheimer's disease, Parkinson's disease, heart disease, autoimmune conditions, all chronic conditions, accelerated aging.